This presentation will provide a brief overview of antibiotics. I'm Bethany Von Hoff and I will be your presenter today. There are many different categories of antibiotics. Use this presentation as well as your study guide to focus on what material is important and likely to show up on the exam. This presentation will be a highlight of common uses and adverse events of antibiotics. Just as there are many classes of antibiotics, there are also many mechanisms of actions. Some antibiotics kill the bacteria and some prevent replication of the bacteria. We won't be focusing too much on specifics, but this slide outlines a few of the common mechanisms of actions and what type of antibiotics work in that mechanism. Penicillins are the oldest class of antibiotics. They are effective at targeting gram-positive infections and are commonly used to treat things such as skin and soft tissue infections and upper respiratory infections. Medications that are part of the penicillin class end in the name "cillin." This is a telltale sign that the agent falls within the penicillin category. An advantage of penicillins is that they are relatively inexpensive and available as generic medications. Also, they do not have the photosensitivity or sensitivity to sunlight that you may see with other antibiotics. Cephalosporins are very similar to the penicillin class. They have a very similar spectrum, although some have more gram-negative coverage than a typical penicillin, which is why cephalosporins are sometimes used for infections that a penicillin will not cover. If someone is allergic to a penicillin, there's a 10 to 25% chance that they will also be allergic to cephalosporins. Depending on the type of allergy, you may want to consider trying a cephalosporin in someone who's had an allergy to penicillins, but if the reaction was severe, like anaphylaxis, it's probably not worth risking. True allergic reactions include things such as hives, rashes, and anaphylaxis. Oftentimes, people will say they had an allergy when they really just had something like an upset stomach. It's very important to ask people what kind of reaction they had and how severe it was when they say they are allergic to something. The next class is sulfonamides. These are typically used to treat infections caused by gram-negative bacteria like E. coli, which cause infections such as urinary tract infections or traveler's diarrhea. A unique adverse event to sulfonamides is that they can impair the immune system, and they also can cause the body to get rid of folic acid, so you do not want to use these medications in pregnant women, especially in early trimesters. Macrolides have great tissue penetration, so they're used very commonly for things such as lung infections or sinusitis, since they can get to the site of action very well. These medications include things such as erythromycin and azithromycin. Azithromycin is often called the Z-Pak, a name you may be familiar with. Tetracyclines are a slightly unusual category of antibiotics. They are commonly used to treat acne, but can be used for other infections such as Lyme disease. Tetracyclines are not to be used in children. Fluoroquinolones are common and effective agents often used for things such as pneumonia and urinary tract infections. Fluoroquinolones can also be used for anthrax. After 9/11, when there were anthrax threats, people were afraid and stockpiling ciprofloxacin. Because of a unique property of fluoroquinolones, they are not to be used in pregnant women or children because they can interfere with cartilage formation. Another rare but serious side effect from fluoroquinolones is that they can cause severe tendinitis. We warn patients about this risk when they use these medications. The last two medications fall into their own classes and are provided here for completeness. Clindamycin is commonly used for skin and soft tissue infections, and metronidazole is often used for anaerobic infections, including bacterial vaginosis and intra-abdominal infections. You may have heard there are some antibiotics that are especially dangerous to drink alcohol while taking, and one of these is metronidazole. It causes a reaction with the alcohol that leads to severe illness. Many of the antibiotics share common side effects. One common side effect is a rash. Sometimes the rash may be mild enough that the patient can continue to use the antibiotic. We worry when a patient has a severe allergic reaction, but since antibiotics are not typically used chronically, if the rash is mild, they can often continue to use the antibiotic. But if it is a severe reaction, then we would not want to use that antibiotic again. Nausea, vomiting, and diarrhea are all common side effects of antibiotics. In addition to killing the bacteria causing the infection, Antibiotics are also killing your normal gut flora, which can disrupt your GI system. Photosensitivity is a fairly common side effect in most antibiotic classes except for the penicillins and the cephalosporins. Another common adverse event is arrhythmias. This can be caused by fluoroquinolones, ketolides, and macrolides. We do watch this carefully, especially if the patient is using other agents that also cause effects in the electrical signaling in the heart. As mentioned before, tetracyclines are not to be used in children because they can cause deposits in the teeth and bones. We'll take a brief pause for self-assessment to answer these two questions. If you cannot answer them, take time to review the slides and the presentation. In summary, antibiotics work through different mechanisms to treat infections. Depending on the infection, you may need to combine different classes of medications. There are common side effects that most antibiotics have, but it is very important to differentiate between a true allergy and an adverse event.